Today I'm going to demonstrate how to use the catheter. So I'm going to show you how to insert and how to remove a urinary catheter. Okay, so to begin, we will want to look at the docket of orders, and we will say that I did get an order to insert and remove a urinary catheter. So before you begin the procedure, before you enter the patient's room, you want to perform hand hygiene. Make sure you get in between the fingers, the palms, the wrist, and the back of the hands. Also, you want to respect the patient's privacy, so you draw any curtains if needed, and you close the door if it is open. Good day, Mrs. Minnie Mouse.
Good day.
My name is Nurse Rae-Yanne, and I will be inserting a urinary catheter. But before I begin, I would like you to identify your name and your date of birth for me, please. Can you tell me your name?
Minnie Mouse.
And what is your date of birth?
2004, January 16th.
Thank you. Okay, this procedure, it's a sterile procedure, so you need to be very careful. Okay, so for the sterile procedure, first you can use your hands because you already performed the hand hygiene. So for the edges, the base of the thing, of the sterile package, you can use your hands, okay, to open it up. So you open it, make sure you don't touch what's inside, okay? So you open it. Okay, and you take out the gloves. You make sure you don't touch the glove self, but you can touch the outside, so the wrapper. Okay, so you always want to start with your dominant hand. So when you're doing it, you make sure you don't touch the outside of the glove. You always touch the inside. Okay, so I can get the inside. Okay, and then you do the same thing. Okay, so the gloves are on. So now we have this towel. Now make sure when you have the gloves on, you cannot touch anything because you don't want to contaminate it because it's sterile now. Okay, so we're gonna put this in between the patient's leg. Make sure you only touch it because you don't want to break the sterile procedure. Okay, and then you have this. Okay, and you're gonna put it right here, so if you don't break the sterile rules, so you can put your hand here. So you want to always clean the patient's private part. So we're gonna break the sterile procedure for one hand. Okay, so you open it, and you have your cotton ball and your solution, and you're going to do it 3 times. You're going to use the cotton ball and the solution, go on the side, then the other side, and then you go one in the middle. And that's for the female. For the male, it's different. For the male, you will go around the penis area. Okay, so yes, that's it. So now, since we broke the sterile rules for the dominant hand, we only have one hand left for the MG tube. Now for the MG tube, you want it moist because it's going to be difficult to insert it in. So if you have water, you put the MG tube and then you start going in. Make sure you can see the hole for it to go in, and then you start going. Now if the patient feels any discomfort, you document it. Okay, so you go in and you make sure that it's the right hole. You continue going in. Okay, and when you see urine coming out, now you're going to go a few more inches in, a few more inches, and then what we do next, okay, so after we're done with this, what you're going to do, you're going to take the solution, you're going to squeeze it out a little to make sure. Okay, and you put it in. Okay, and then you do it very gently. Okay, and you insert all. You put all the liquid, the fluid. Okay, so it's going to be like a balloon, a small balloon. Okay, and then when you're done with putting the solution, you are going to, yes, you are going to slightly go down to make sure that the tube is not coming out. It doesn't come out, because it could come out if it's not tight enough, or if it's not properly in. Okay, so that's how you put it in. That's how you insert a urinary catheter in a male and female. Okay, so whilst it is still in, you would you want to ensure that the tube is secure on them. So you secure it like on the leg, and the bag, the urinary bag, you place it on the side of the bed. Okay. Now not on the bed rail, because the bed rails, they move. So you place it somewhere that is secure and that doesn't move. Document your findings, any abnormal findings that you get, you document it, and you remove the sterile gloves. You remove it, and you perform hand hygiene, and that's it. You make sure that the patient is comfortable, and yes. So we just performed how you insert a urinary catheter. Now we're going to do the removal. Now we did all the introduction procedures. We introduce ourselves to the patient. You hand hygiene, perform hand hygiene, and you will respect the patient's privacy by drawing the curtains or closing any doors. Now for the removal, what you're going to do, you're going to first start off by removing the liquid in the tube, so it can come out. So yes, so we're going to remove the fluid first. So you go in. Now sometimes it doesn't come out by itself. Sometimes you have to like pull it a little, but sometimes it will just do it automatically. So it's coming out. Okay, and then once all is out, you remove the tube. Okay, whatever you had holding the catheter, the tube on the leg, you remove it as well, and you take out the urinary bag and you dispose of it in the appropriate area. Okay, and that's it.